So we've been following how hospitals are making the best use of their space in order to handle COVID-19 patients. Well, joining us now is Dr. Kenneth Robinson, Chief of Emergency Medicine at Hartford Hospital. Thank you for being with us.
Good afternoon.
First, tell us about the state-of-the-art observation unit. What does it consist of, Doctor?
Well, we had recently built an observation unit right off of the emergency department that was planned for about 18 months or so, and the construction finished in March and was scheduled to open April 1st. But because we've been seeing an increased number of COVID patients, we thought that it would be better used as a COVID ICU because the number of ICU level patients in the hospital is increasing. This unit was designed for flexibility, and we designed it so that it could flex to be open as an ICU. So it's configured like any other ICU in our hospital.
And what specific changes did you have to make to turn it into the ICU that it is today?
Well, the bricks and mortar of the unit didn't need to be changed because, like I said, they were built to accommodate an ICU. We needed to make sure we had the appropriate equipment. We needed to move some ventilators downstairs and change some of the way the IT or the computer software works to document and care properly for intensive care unit level patients.
And for basics, for people who may not have been around hospitals much and they're lucky, what is the difference in care with an ICU? Can you just give us a little 101 on that, what patients get in an ICU?
Absolutely. The ratio of nurses to patients is much smaller. Generally, it's one or two patients, or maybe three patients per nurse in an ICU. There are many more providers as well, again, a smaller ratio. There's a respiratory therapy team. There's teams that are basically dedicated to the intensive care units, and the care occurs, more than hourly.
Okay. Dr. A.J. Kumar said that our state's peak will be end of April, early May this morning in his briefing. What has been the surge capacity like in your ER at Hartford Hospital? Have you had to use the new unit yet?
Our volume is starting to increase. We are definitely seeing more COVID positive and COVID related patients over the last couple of days. It feels that way since maybe Saturday or Sunday. Our volume is not where it was previous to the COVID surge, meaning our total volume is still a little bit down, but we're definitely seeing more COVID-related patients at this time.
Okay, and then finally about the new unit. Did you have to train your ER staff, kind of adapt to that as well? Tell me about who's providing care in that unit.
This was a huge collaborative effort among nursing teams from many different departments, and also respiratory therapy and pulmonary critical care and surgical critical care and anesthesia and cardiology and emergency critical care. And we have the luxury of having a simulation center at Hartford Hospital called SESI, and some of the staff has done some training there to be ready to provide intensive care unit level care. In this unit, there's some subtle differences between this unit and others in the hospital that they just needed to be trained on. And the end result is that the care in this ICU will be the same as the care in any other ICU throughout Hartford Hospital.
Sounds like a great collaboration. Dr. Robinson, thank you for joining us again. We appreciate the update.
Thank you.